SEWHO is applied to the wheelchair around a normal wheelchair armrest. You have to size that bottom plate that has those different slotted adjustments properly to squeeze that armrest tightly enough to hold it in place. There's a considerable amount of pressure that's exerted, that can be exerted by the upper body leaning against this, that you've got to make this thing pretty snug. These bolts, when wound all the way up nice and tight, will do the job just fine. Now you see that the unit is firmly attached. These are adjustment bolts for modifying, changing the height, the vertical height of the unit. This thing will go down all the way level with the top of the chair. I don't think there's another SEWHO out there that will do that. It'll also give you a lift of about 5 inches. So depending on the arm condition and the clinical condition of the patient, you can get the height exactly where you want it. Those bolts fit in the holes on the blocks behind them, keep the unit from moving. And then this is the integral WHFO arm tray, and there are 2 adjustments here. These are locking adjustments that fit into the slot of the stud below it, keeping it from coming apart. And this one goes onto the slot on that upper post, and it drops down on there. Same situation, you lock it there, and you want to just push that into the slot of the stud that's sticking up there, and that way it won't come off. The red knob, you can tighten that up and squeeze that to prohibit or slow movement, increase friction against the user there. The back of the arm tray is a elbow stop. Here you see the arm in the arm tray. You can bend this to accommodate a lot of clinical conditions in the hand, the WHFO. So you've got an extra code that can be built out here. You get, with that arm tray, stop it. There's your vertical adjustment, just shown with the arm in place. Once you get that stopped up where you want it, you lock it in place with these bolts that go in the pilot holes, and now it's locked in place, and you can get exercise, you can get movement with the arm in the SEWHO. It's a very nice unit, compact, easy to apply.